If you have an L4, L5, or an L5S1 disc bulge and every step sends shooting pain down your leg, keep watching. Most patients are told recovery will take months, maybe even years, but that's not always true. In this video, I'll show you how to speed up your disc bulge recovery without surgery, without drugs, or months of therapy that's simply not working. This is the same 3-layer plan we use in clinic that's helped 90% of our patients avoid back surgery, even when all other therapies hadn't worked. You'll start with 3 disc bulge recovery exercises that begin to safely reduce pressure on your disc today. Then I'll tell you the 4 supplements that I give to our patients that feed the disc essential nutrients needed for repair, reduce inflammation, and speed up healing. Finally, I'll walk you through the professional steps that restore alignment, balance muscles, and build a strong spine. This is the real key to lasting relief. Be sure not to miss that part. If you're stuck in pain, can't work, and feel like nobody's giving you answers, this video will give you the roadmap you've been searching for. Hi, I'm Dr. Zielonka. I'm a neurofunctional chiropractor in Ottawa, Ontario, Canada. I've been doing this for almost 35 years now. My YouTube channel focuses on helping those who've been suffering from debilitating chronic back and neck pain. Before I dive into today's video, I need you to smash that subscribe button if you want to learn more tips and strategies on how to treat and relieve debilitating back and neck pain without drugs, without surgery. I upload a new video every week. Let's start with what matters most right now, quick relief. These 3 gentle exercises are where we begin with almost every patient dealing with L4, L5, or L5S1 disc issues, especially when there's leg pain, sciatica, or stiffness. They're safe, effective, and you can do them at home, no equipment needed. And just doing these 3 consistently has helped hundreds of our patients get noticeable relief within days, sometimes even on the same day. Number 1 is the cat camel. This is a gentle way to reintroduce motion into the spine, and when your disc is irritated or inflamed, movement done the right way helps reduce stiffness and calm the nerves. So you're going to start on your hands and your knees. You're going to slowly arch your back upward like a cat. You're going to hold that for a second or two. Then you're going to slowly drop the belly. You're going to lift your chest like a camel hump reversing, hence cat camel. You're going to go back and forth gently 10 to 15 times. No fast jerky movements. There's just going to be smooth, controlled movement. You're not trying to stretch, you're just simply trying to glide the joints and reduce pressure through gentle motion. Number 2 is what we call prone lumbar extension. So this is one of the best positions for helping centralize your disc pain. That means we're bringing it back to where it started. We don't want it coming down the leg, so this is especially true when symptoms shoot down that leg. You're going to lie face down on the floor with your hands under your shoulders like you're about to do a push-up. You're going to slowly press your upper body up while keeping your hips on the floor. You only go as far as comfortable. That old adage, no pain, no gain, does not, never has, never will apply to this particular move. You don't want to push in the pain. You're going to hold for a second or two at the top, then you're going to lower back down. Again, you're going to repeat this 10 times, slowly and controlled. Remember, it's not no pain, no gain. This movement can help shift pressure off the disc and back towards the center. It's a key step in calming nerve irritation. And number 3 is what we call sciatic nerve flossing. So this is a powerful but gentle way to improve mobility in the sciatic nerve and reduce that tight electric burning sensation down the leg. So you're going to sit on a chair with good posture. You're going to extend one leg straight out in front of you while pulling your toes towards your face. At the same time, you're going to gently tuck your chin forward towards your chest. Then you're going to relax back to that same starting position. Again, repeat 10 times on each leg, nice and slow. This helps the nerve glide more freely through the tissues, reducing that trapped inflamed feeling without stretching the disc itself. These 3 exercises are just the starting point, but they're a powerful start. They help reduce pressure, calm inflammation, they start restoring motion, all without risking further damage. And when done consistently, they've helped hundreds of our patients get relief at home. But this is just the first layer. Next, we'll go deeper into the supplements I give our patients, the ones that actually feed essential nutrients to the injured disc and support faster healing from the inside out. Now that you've got the pressure off the disc and the pain is starting to calm down, we need to support the healing process from the inside. This is where the right supplements make a big difference. So this is not just simply buying something off Amazon or going into a Costco. These are targeted nutraceuticals. In our clinic, I guide patients through specific nutrients that reduce inflammation, hydrate the disc, and create a stronger environment for recovery. Think about it. Do you want to keep taking drugs that simply mask the pain, or do you want to actually be taking the nutrients that are going to start the healing. So let's walk you through what we use. And if you don't have access to these exact blends, I'll show you what you can look for when you buy from your wellness store or supplement store. So number one is something we start with, what's called Acute One. This is from Core Science. I like Core Science because it is one of the most reputable brands on the market. This becomes important because unfortunately you don't always get what you pay for. So those one-a-days, those life dailies, all those, there's only one scientist who's ever legitimately looked at all of the products on the market and actually rated them on a scale of 1 to 5. And the first time he did this some 10, 15 years ago, out of 1,500 products, 4 got a 5-star rating. Okay, today's a little better, but still less than 1%. Core Science is one of those brands that is looking is that 5-star rating. Okay? You're talking quality, combinations, research, science, et cetera, et cetera. So please invest in your health. So in Acute One, we use this as a natural anti-inflammatory. So it's a fantastic thing. I mean, you want to bring down the inflammation without all the nasty side effects of all the anti-inflammatories on the market. So all the prescription ones, Motrins and Advils and ibuprofens, the prescription ones, the Naprosins, Arthrotex, Voltarens, they are nasty on the stomach, so much so that people actually die from taking these on a long-term basis. That's why we moved to the Acute One. What a lot of people don't realize is these targeted nutraceuticals actually work just as effectively without any of the nasty side effects. If you can't find this in the in your wellness store, you're looking for things such as bromelain papain, boswellia, all the things in the science that have actually shown to reduce inflammation naturally without irritating the stomach. That's the nice thing. Core Science Acute One actually doubles as a digestive aid. It'll benefit the stomach, not hurt the stomach. Number two that we use in here is also Core Science. It's called OA Max. So OA stands for osteoarthritis. We want to start rebuilding that degenerating disc, and that can be done. Go to our website, look at the research, look at the clinical studies that actually come straight out of this office, look at the pre and post x-rays, and you will see we're not just stopping degenerative disc disease and osteoarthritis, we're actually reversing it as proven on pre-post x-ray on the clinical studies themselves. There are nutrients that will help that, and this becomes so important because what a lot of people don't realize is that the body's capable of producing some of these nutrients. It stops doing that about age 40 or so, give or take a year, which no one is telling you. That's why you need to replace what's missing. So this is going to be things like your glucosamines, your MSN, things such as that. I'm not necessarily as big a fan on the chondroitin sulfate because there's some question whether or not that actually gets where it needs to go and so forth. But if you're not taking the Core Science OA Max, then again, start to look for that and get reputable brands in a wellness store that are going to be the glucosamines, the MSNs, that type of thing as well. Number 3 on our list, this is again a Core Science product, the professional grade EPA DHA. So a lot of people just say, oh, you mean fish oil? Well, there are very particular constituents to that fish oil. And especially when it comes to fish oil, this is where you really have to make sure you're getting a good source, because a lot of fish oil that you're buying off the shelves is rancid, not giving you the quantity or the quality that you need and so forth. Again, that's why I like the Core Science brand. What you're looking for is essential fatty acids, EPA, DHA. They do so many things, everything from brain health to heart health and so forth. But what they do is they can influence what we call prostaglandins. I don't want to get into a big discussion or complicated discussion here, but taking the right ones can actually change your body's ability to either make good hormones or bad hormones. It can change your body's ability to actually create inflammation in the first place, not to mention it will also help to heal the nerve in there as well. Yeah? And the last thing we do, speaking of the nerve, again, Core Science brand, is called Nerve Regen Max. So those nerves have been, in most people with chronic back pains, chronic serious back pain, chronic serious neck pain, the sciaticas, the spondylolisthesis, the disc herniations and bulges, degenerative disc disease, those nerves have had pressure on them for a long, long time. It only takes the weight of a dime to actually decrease nerve function by 50 to 60%. And over time, those nerves will become damaged. So Nerve Regen Max actually has the nutrients that can actually give the body the energy to start to heal the damage you've done to the nerves. So these would be, again, I much prefer the Core Science Nerve Regen Max because of the particular types of nutraceuticals that are used. But if you're going out into your typical, again, wellness store, again, I would avoid in most cases, the Amazons, the Costcos, the drugstores and so forth. You're looking for, this is the B family of vitamins, but there are different types of B family of vitamins. So specifically B1s, 2s, 3s, 6s play a role as well. But again, it's not simply looking at your bottle and going, oh, well, this has 50 of this and this has 50 of this. It's something where you need that. You need the quality. You need the raw ingredients of good quality. You need a lab that knows what it was doing and actually meets all the standards that we're looking for as well. Those are typically the four main ones, but again, it all depends what you come up with. That's the nice thing about any of our programs. It's always going to be specific to you. I'm also often very big on helping people with their sleep, because if you can't sleep, whether it's from the pain or just poor at sleeping, you're not giving your body the chance to actually then do the repair work that it needs to do for the body as well. So the first two layers, the neuromuscular, re-education is what we get into in clinic, but definitely the three exercises that we started with and the targeted nutraceuticals are things you can start doing right now today to actually start getting some immediate relief. But what if that's not enough, which in most cases of serious back pain, you're going to need to do more. If you're still struggling with pain, stiffness, or nerve symptoms that just won't let up, that's when it's time to consider professional treatment. So next, I'll walk you through the exact three-part treatment protocol we use in our clinic. It's the same one that's helped over 90% of our patients recover in a number of weeks. And one of these methods is so unique, it's only available in 12 clinics worldwide. By now, you've seen what can be done at home through neuromuscular re-education and very targeted nutraceuticals. But for many patients, that's not enough, and here's why. Disc injuries are rarely caused by one single issue. It's usually a combination of structural problems, muscle imbalances, and nerve dysfunction. If you only treat the symptoms with pain medication or injections, you may feel better for a few hours or a few days, but you're not fixing the real problem, and it will come back. And it's not just about doing more stretches, applying ice, or using a TENS machine. Those might help temporarily, but they won't correct what's driving the disc to bulge or herniate in the first place. This is where our approach is so different. We're actually getting the body to heal, and we're actually addressing all of the underlying causes. There are three key components to our in-office treatment protocol, and when combined with those neuromuscular re-education exercises and those targeted nutraceuticals that we've already covered, this is where real recovery happens. So the first of the three protocols that we do in our clinic is what we refer to as neurofunctional spinal correction. So what that is understand that anyone with disc herniations, disc bulges, spondylolisthesis, degenerative disc disease, stenosis, you're going to have spinal misalignment. So remember, in the spine, we've got vertebrae, we've got the disc, we've got another vertebrae coming out of these openings, or the nerves themselves. And so a spinal misalignment, and you can call this whatever you want. You can call this a spinal misalignment, which is easy to understand. A lot of chiropractors call this a subluxation. It's a big fancy scientific term that simply means that not only has the vertebrae become misaligned, but when you do that, a number of things are going to happen. You're going to lose its normal movement. It's going to compress the disc. It's going to cause the muscles to go out of whack. The biggest thing it does is it's going to obstruct that nerve. And when you start to obstruct the nerve, that's like playing with the hard wiring of your body's own computer. If you're older age group, you'll understand that better as messing with the electrical wiring in your house. If I pull a fuse, if I compress a wire somewhere else in the house, it's going to dim a light in a different room type of thing. If you're younger, you might think of this as your body's own internet system. So what we do, though, is something very specialized called neurofunctional spinal correction, because understand that to say that all adjustments or all chiropractic is the same is like saying I went on a diet and I tried food. So what we do so differently in neurofunctional spinal correction, we're not just looking to take that pressure off that nerve, and we're looking to actually restore normal movement, normal function. It's not about chasing pain. It's not simple. You could have a spine that looks perfectly straight, and you could actually still have a lot of dysfunction in that spine. So that's the key thing. And in doing so, if we can take that pressure off the nerve, help take pressure off the disc, think of the robotic reduced mounting compression as the main movement. This is what I call the fine tuning, but it's hugely important because your nervous system controls everything in the body. And the more we can get properly realignment back there, the more we can get rid of those obstructions, the better the body's going to heal. The second protocol that we do in our clinic, in addition to the nutraceuticals and to the neuromuscular re-education that you can do at home as well, is something called muscle tissue restoration. Now, this is incredibly important. Is understand that if your spine has been that misaligned for that long, if the disc has been that herniated, if the discs have degenerated in there. Understand those muscles attach to all those vertebrae, and those muscles are controlled by those nerves. So what happens over time is like a repetitive strain type of injury. Those muscles are going to become what we call adhesed, and eventually going to become will be turned into what we call scar tissue. So the way I explain this to patients, let's say you were to cut your forearm here. A scab is going to form, and when that scab is there, if I tried to move that skin, obviously that skin's not going to move the way it was intended to move because you've changed the tissue. But the scab will eventually fall off. You'll eventually come back to normal. When we do this on the inside of the body, it's not from a cut like you would get with a scab. It's going to come from repetitive strain, injury, and so forth. And you've actually damaged what's going on inside there. Now, the problem with that is we don't call that a scab anymore because it doesn't magically fall off. We're going to call that fibrous adhesion, or if it's been there long enough, we're going to call it scar tissue. But now appreciate, for instance, in my forearm, this is the easiest to show you. You can have a tendon beside a tendon beside a tendon beside a tendon. Well, now if they've been scarred or adhesed together, every time you ask one tendon to move, it can't really do that because it's actually stuck to something else that it wasn't meant to be stuck to. And every time you do that, you're actually going to pull on a muscle or tendon that you didn't intend to move. Plus, every muscle tendon attaches to bone, so now you're abnormally pulling on the bone as well. This is very true when it comes to the low back. You've got your glutes, you've got your piriformis, you've got your quadratus lumborum, you've got so many muscles that stabilize that area in there. You've got the hip flexors, and now if they've been scarred or adhesed, you're going to create all sorts of imbalances in there. You can try to stretch forever, and you'll find you'll never be as effective as you want because you've literally scarred up that tissue in there. So that's what muscle tissue restoration is all about. The technique we use is something called active release techniques. I was one of the first doctors in Canada certified in this some 25 years ago. And what we're doing is we're not going in and just rubbing a muscle. We can go in and we can literally feel where they've been scarred or adhesed together, and we can actually start to separate that, get rid of that scar tissue, and restore normal movement and normal function. And the third form of care that we provide inside the office of our 7-step solution, so 3 are happening in the office, is actually the most advanced part of our program. I've already alluded to it. We use some revolutionary healthcare technology called non-surgical robotic laser spinal decompression. So first, let's break that down. Spinal decompression is a non-invasive therapy that gently decompresses the spine in a controlled, precise way. This creates negative pressure inside the disc. It's the negative pressure that's the key to all of this. That's why true spinal decompression is not the same as traction, is not the same as hanging upside down on your inversion cable. I have one of those in my home gym as well. True spinal decompression creates negative pressure in the disc. That allows that bulging or herniated material to retract. It helps to draw fluid and nutrients back in. It reduces pressure on the nerve. It gives the disc space to begin healing. We combine that with class 4 robotic laser therapy. So that uses deep penetrating light energy to reduce inflammation, accelerate cellular repair, improve circulation in that injured area. It's completely painless. It stimulates healing at the source. Each of these on their own can help relieve pain and support disc recovery, but the real breakthrough happens when you combine them in a single treatment session at the exact same time. That's exactly what non-surgical robotic laser spinal decompression does. Imagine spinal decompression and class 4 laser working together in real time, guided by advanced robotic technology. While the spine is being gently decompressed, the laser simultaneously delivering deep tissue healing to the disc, the nerves, and the surrounding area. The result is faster pain relief, improved mobility, and true structural recovery. This combined technology is so advanced, it's only available in 12 clinics worldwide. We are the only clinic in Ottawa, Ontario, Canada to have one. Non-surgical robotic laser spinal decompression has been the key factor in helping over 90% of our disc bulge patients recover. Even those with severe cases who were told surgery was their only option have seen success here. You've just learned the exact 3-layer plan we use to help patients recover from L4, L5, and L5S1 disc injuries, including simple at-home exercises to relieve pressure, the right supplements to support faster healing from the inside, and a professional treatment strategy that targets the root causes, not just the symptoms. And remember, it must start with a thorough consultation and examination that finds all of the underlying causes specific to you. This approach is designed to help you start feeling better now and to set you up for long-term recovery that actually lasts. If you got value from this video, make sure to like it and share it. It could help someone else who's been stuck in pain and doesn't know what to do next. Please leave a comment below and let us know how things are working out for you. We read each and every one of them. We're here to support your recovery. And if you want more tips and strategies on how to treat and relieve debilitating back and neck pain without drugs, without surgery, make sure to subscribe. The next video you should watch is this one, where I share 3 real patient stories using non-surgical robotic laser spinal decompression. The results might surprise you and inspire you.